Cip Zox Tablet, uses, dosage, side effects, and precautions. Cip Zox Tablet is a widely prescribed combination medicine used to treat painful muscle spasms and inflammation due to musculoskeletal conditions. It offers dual action, relieving pain and relaxing muscles, making it a preferred choice in treating bone, joint, and muscle-related discomfort. What is Cipzox? Cip Zox Tablet is a combination of 3 different medications: diclofenac, paracetamol, and chlorzoxazone. It is used to treat painful muscle spasms caused by musculoskeletal conditions, as well as to minimize joint and bone swelling. Cip Zox Tablet relaxes muscles by interfering with the processing of chemicals that cause inflammatory reactions, such as prostaglandin, and by sending unpleasant signals to the brain from the site of pain. This medication should be taken as directed by your doctor, preferably after meals. What are the benefits and uses of Cipzox? Cip Zox Tablet uses extend across various painful conditions, making it a versatile treatment option. The medication provides effective relief from multiple types of pain and inflammation through its unique combination of active ingredients. Conditions Cipzox treats. Cipzox is primarily used for managing painful muscle spasms associated with musculoskeletal conditions. The medication effectively treats urinary tract infections, UTIs, to treat infections in the urinary tract caused by susceptible bacteria. Respiratory tract infections, to manage bacterial infections in the lungs and airways, such as bronchitis and pneumonia. Gastrointestinal infections, to treat infections in the digestive tract, including those caused by bacteria and protozoa, like giardiasis and amoebiasis. Gynecological infections, to address infections in the female reproductive system, including pelvic inflammatory disease. Skin and soft tissue infections, to manage bacterial infections affecting the skin and soft tissues. Secondary uses of Cipzox. Beyond its primary applications, Cipzox provides relief from headaches, toothache, period pains, rheumatic pain, tendon pain, gout, soft tissue injuries, backache, arthritic pain, sprains, strains, frozen shoulder, and muscle pain. How does Cipzox work? Understanding whether is Cipzox a painkiller requires examining its mechanism of action. Yes, Cipzox functions as both a painkiller and muscle relaxant through its 3-component formula. Cip Zox Tablet relaxes muscles by interfering with the processing of chemicals that cause inflammatory reactions, such as prostaglandin, and by sending unpleasant signals to the brain from the site of pain. Each component works differently. Diclofenac sodium inhibits prostaglandin production to reduce pain and inflammation. Paracetamol acts as an analgesic and antipyretic, while chlorzoxazone works on the brain and spinal cord to relax muscles and reduce spasms. Cipzox dosage. Proper dosage is crucial for safe and effective treatment. The Cip Zox tablet dosage per day should always be determined by a healthcare professional based on individual needs and condition severity. Typical dosage instructions. The typical dosage is 1 tablet taken twice daily, usually after meals, as prescribed by a healthcare provider. For adults, the standard recommendation is 1 tablet taken with food, 2 or 3 times daily, with tablets swallowed whole and not chewed. The duration of treatment usually ranges from 5 to 14 days, depending on the type of infection and the patient's response to the medication. What should I do if I miss a dose? If you forget to take your drug, take it as soon as you recall. If your next dose is approaching, skip the skipped dose. Do not take a double dose to compensate for a missed dose. What happens if an overdose? High doses of Cip Zox tablet can cause severe liver and kidney damage. Overdosing can also cause headaches, nausea, vomiting, and stomach pain. If you think you've taken too much of this drug, call your doctor or go to the nearest hospital right away. Symptoms of overdose: severe liver and kidney damage, headaches, nausea and vomiting, stomach pain. What to avoid? Avoid taking more than the prescribed dose and never double up on missed doses. What are the side effects of Cipzox? Like all medications, Cipzox can cause side effects, though not everyone experiences them. Most side effects are mild and resolve on their own as your body adjusts to the medication. Common side effects. Cipzox side effects commonly include diarrhea, nausea, heartburn, stomach pain, vomiting, dryness in mouth, loss of appetite, liver problems, fatigue, blurred vision, indigestion, rash, insomnia. Serious but rare side effects. Cipzox can cause some serious side effects and can lead to some serious health problems, including liver problems. If you are facing any serious side effects, talk with your doctor immediately. If any of these side effects bother you or do not go away with time, you should let your doctor know. Your doctor may help with ways to reduce or prevent these side effects. Precautions and warnings. Before taking Cipzox, discuss your medical history with your doctor, especially if you are allergic to it or any other medications. The drug may contain inactive ingredients which can cause serious allergic reactions. Who should avoid this medicine? Before taking the medications, talk to your doctor if you have any medical history such as liver disease, kidney disease, stomach ulcer, and abdominal pain. Conditions where caution is needed. In patients with kidney disease, Cip Zox Tablet should be used with caution, and dosage may need adjustment. In patients with liver disease, the tablet should be used with caution, and it should not be used for patients who have serious liver disease or active liver disease. Warnings for serious health conditions. Pregnancy. Cip Zox Tablet should not be used during pregnancy because there is clear evidence that it poses a danger to the growing infant. However, in certain life-threatening circumstances where the benefits outweigh the risks, the doctor can prescribe it. Please seek medical advice. Breastfeeding. Cip Zox tablets should not be taken if you are breastfeeding. The medications can pass into your breast milk and can cause some serious side effects to your infant. Are there any age restrictions for using Cipzox? The medication is generally prescribed for adults, with specific dosing considerations for geriatric patients. Always consult with a healthcare provider for age-appropriate dosing. Alcohol or food interactions. Avoid consuming alcohol while taking Cip Zox tablet, as it might increase the likelihood of side effects. The medication should be taken after meals to reduce stomach irritation. Possible interactions with other medications. Drug interactions. Cipzox may interact with various medications, potentially affecting their effectiveness or increasing the risk of side effects. Always inform your healthcare provider about all medications you're taking. The medication may interact with drugs such as amitriptyline, carbamazepine, methotrexate, phenytoin, ramipril, tramadol, sodium nitrite, prilocaine, and apixaban. These interactions can affect how the medications work or increase the risk of serious side effects. Possible impact when combined with supplements, herbal products. Certain foods and supplements may interact with Cip Zox tablet. It's important to discuss all supplements and herbal products with your healthcare provider before starting treatment. How should Cipzox be stored? Proper storage ensures the medication maintains its effectiveness and safety. Store the medication correctly to prevent degradation and maintain therapeutic benefits. Recommended storage temperature for Cipzox. Store Cip Zox tablet in a dry place, safeguarded from direct sunlight and heat. Maintain storage temperature below 30 degrees Celsius. Store protected from light and moisture at a temperature not exceeding 30 degrees Celsius. What happens if Cipzox is not stored properly? Direct contact with heat, air and light may damage your medicines. Exposure to medicine may cause some harmful effects. The medicine must be kept in a safe place and out of children's reach. Mainly the drug should be kept at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius. Keep away from children, sunlight, and moisture to maintain the medication's integrity and prevent accidental ingestion by children or pets.